visi and objective of BPJS Kesehatan is not only to increase the access of care, on giving protection and quality of care, but also actually make more efficient. And of course, we have too many collaborators and stakeholders, and not only here. And now, and our members to 269 million people, or more than that, and we are having epidemiologic transition. So with non-communicable diseases is increasing, for example, like diabetes mellitus and so on and so forth, and heart diseases. And you see here, compared to, for example, like in Germany or Belgium, we need to achieve universal coverage more than 100 years. In Indonesia, I think, according to this Lancet, the fastest is South Korea, need 12 years. Indonesia, now we are in the 10 years, and we almost achieve 98% of our population. So here, actually, the BPJS Kesehatan, our beneficiaries consisting of subsidized premium groups, and then those who having wages, where the employers have the obligatory to pay 4%, and the also employees, and then contribution approximately for informal sector especially $3, 6, and then 10. It depends on them. But all of this, of course, that we contacted with primary health care, also hospitals. In the primary health care, the way we pay using capitation is performance and non-capitation. Then also for the hospital, we use DRG system, where it first time were developed in Yale University. But all of this should make the main activities are supported by advanced IT system, especially IT transformation. And I think I would like to say this. Yeah, so might be very rare, like in US, the single system, single schemes. We in Indonesia, previously we had many schemes, more than 300, because local government initiative schemes, and then merged into integrated one scheme and 96 coverage. Then we usually, since it was inception, always deficit. Now it's not deficit, now we are surplus. And then we give down payment to the hospital, increase the tariff, and satisfaction also increasing. The important thing is the out-of-pocket from 49.7% now reduced to 25%. And here, how we manage information technology as backbone of the National Health Insurance Program or JKN program. So we have this center. So it is our command center. We control all the behavior of hospital and primary care. In fact, we control each doctors, physician who are working, for example, every day, how many surgery they have done, and how many, whether the hospital is committed fraud or not, thing like that. We use this big data as the, using the IT system, especially digital transformation, then we can trace whether actually committed fraud or not. Next slide. Okay, so now many people are coming, I think you also there. And that is one of the comment from some people who are watching and seeing.
It's not only been aspirational, but it's also been inspirational to a lot of countries which come from the same context, lower and middle income countries that are aiming to achieve universal health coverage.
And then also coming to see the command center, I found the command center also something that is remarkable for me, that it helps you to get a feel of what is happening on the ground, and then how it is being used also to drive enrollment and all. I think I'm highly impressed.
I congratulate everyone who's worked on BPJS. It's amazing to see the level of coverage across the country. and to see the attention to equity and meeting the needs of the population.
The integration between levels of the health system and from providers to BPJS is something that's really stood out. So the way that the technology has been used and information is shared to provide better care for the population is something that's been really impressive, and I'm excited to learn more about it.
So I was very impressed by how efficient the leadership, how efficient the management of everything is.
BPJS Care.
So there's everything. It should be, using the approach digital transformation. So basically, we have 4 types of components. First, that BPJS Kesehatan has connected with healthcare providers using transformation, digital transformation, with the bank, finance, too many connected, and then also with the members, and many applications we develop to facilitate and enable, also to accelerate many things to the membership, also with interconnected, especially with government institution, with Ministry of Health. And I'm so sorry to say that in BPJS Kesehatan Indonesia, it's not under Ministry of Health. We are directly under President, and too many government agencies and ministries we have to connect. So therefore, we give the dashboard, for example, or with the bank, for example. So now we have payment channel more than 900,000. So collection rate of the premium, because we have to collect premium contribution from one company to other companies.
BPJS Kesehatan.